Hi, everyone. My name is Karina Gomez, and I'll be presenting this presentation today on health coverage through Connect for Health Colorado. Our agenda today, these are the topics we will be discussing. Who are we? What is Connect for Health Colorado? Health insurance literacy, finding a provider, the explanation of benefits, also known as the EOB, and any additional questions, we'll have our contact information at the end of the presentation. So you guys can contact us to schedule an appointment or for any further questions at that point. Who are we? We are the Boulder County Health Coverage Enrollment Center. We offer individual appointments. We offer education, guidance, and assistance with the enrollment process for Connect for Health Colorado, OmniSalud, and Medicaid. Our services are free, unbiased, and 100% confidential. To schedule an appointment with us, this is our website. This is where you'd be going, and it would be www.bouldercountyhealthcoverage.org. Once you get to the main page, you'll hit this button here. It says schedule an appointment, and then it will take you to the second page. So you get three options. You get the OmniSalud appointment, which is a 45-minute appointment. You get a new and renewing coverage, which is a 60-minute appointment with one of us, and then a general question, which is a 30-minute appointment. So kind of depending on what you need, schedule that accordingly. But yeah, those are the three options we do have. What is Connect for Health Colorado? It's the official health insurance marketplace, and it helps individuals determine your eligibility for financial assistance such as premium tax credits and cost sharing reductions to lower the cost of health insurance. This is one of the most important things, the enrollment periods when it comes to health insurance. So open enrollment is November 1st through January 15th. After open enrollment, you can still enroll in health insurance plans, but you do need a qualifying life-changing event. And you'll see, a QLCE time, little abbreviations there. So anytime after that, the quality life-changing event, that's if you've had a baby, you've moved, different jobs. So you would need a life-changing event at that point. You can also check the Connect for Health Colorado website for specific, life-changing events they go more into detail and specific situations. Also, the 150 FPL income, and FPL is federal poverty limits. So anybody who's below that at 150% or below that 150% federal poverty level, then at that point that would also qualify for a life-changing event to enroll for health coverage after January 15th. There's also the tax time enrollment. So that the deadline is April 15th. That's when you are supposed to file your taxes. You have it up until that day. So anytime from January 16th and up until April 15th. So you'll, on your tax returns, when you're filling that out, there is a check mark asking if you're interested in health coverage. So then at that point, you would just select yes. Once that occurs, then you'll be receiving a letter, and then that letter opens up the portal for as a qualifying life-changing event in a sense. After from January 16th through April 15th, and that with that letter you can use it up until November, November 1st, open enrollment at that time. Medicaid, if you want to apply for Medicaid, you can apply for Medicaid at any time throughout the year. It's not a specific time. That is just make sure that you are qualifying when it comes to income, your monthly income. But yeah, everything in that sense, you don't have to have a life-changing event to apply or qualify for Medicaid. You can apply through it throughout the whole year. Financial help. So financial help, depending on factors including family size and annual income, Coloradoans may be eligible for financial help in two forms. So that is the lower monthly premium And what the premium tax credit is, it's to help you pay for your monthly premium. And number two, healthcare discounts. So the cost sharing reductions that reduces the cost of copays, deductibles, coinsurance, and out-of-pocket maximums in silver level plans. 10 essential health benefits. So every plan through Connect for Health Colorado will have the 10 essential benefits. That's emergency services, laboratory services, outpatient care, um, services for children, prescription drugs. So all of these on here, those are what we consider the 10 essential health benefits. And then on here also, one thing I would like to touch base on is some plans may also offer more services or exclude cost sharings for additional services that matter to you. And then just make sure that once you select a plan or you're looking into a plan, to check the summary of benefits of coverage documents. And again, you can always schedule an appointment with us or give us a call to kind of find that or locate that. But when you're looking at plans, that should be an option to go more into detail when it comes to your plans. Free preventative services, all health insurance plans sold through Connect for Health Colorado also provide a set of free and preventative services. These services are covered even if you have not met your deductible at that point. The free preventative services could include vaccinations, immunizations, different types of screenings, or any counseling for some of these for diet, obesity, sexual transmitted infections. You can also view the full list of these free preventative screenings for your plans at healthcare.gov. Um, and you can screenshot this and or paste and copy from the video on here, and yeah, go into it, go see that available list. Just that way you can get a better sense when it comes to the free preventative services that these plans offer. And also, you may have to pay for services that aren't preventative. So, for example, if you go to your doctor, a doctor's appointment just to get your immunizations, in that visit, and all of a sudden you're like, oh, also, doctor, I've had this rash or this sort of different pain. Can we take a look at it or can we discuss it? So at that point, that could potentially be considered like something way different compared to just being there for your immunizations. So then at that point, you could potentially be paying out of pocket for something else or like a percentage depending on your health insurance. So it's very important just to discuss with your doctor, like, hey, is this a part of my free preventative service, or is this something that I'm going to have to be paying additional, since it's just a different question and we weren't scheduled for that. So we've heard a lot of, we've gotten some feedback from clients when it comes to that. So again, check with your doctor. Best way, best practice to just, talk to them when you're checking in. Um, but if you have any questions regarding your services and what is covered, you can always contact your insurance company directly and they can give you a better understanding of what is covered and what is not. And here we'll start going into a little bit of terminology of, words that you're going to be seeing when you purchase health insurance or now that you have it. Your deductible, for example. So your deductible is a fixed amount you must pay each year for the health coverage services you receive before your health insurance begins to cover the cost. So for example, so before your deductible, you pay at a full cost. So you are paying everything out of pocket. And then, once you meet your deductible, then the health insurance starts to pay their portion of it. So you share costs with your insurance after your deductible. So before you pay full cost, and after you meet your deductible, you share costs with your health insurance. The coinsurance. The coinsurance is the percentage of medical costs that you pay after you have covered your deductible amount. So for example here, and please always make sure that you check with, your summary of benefits or call your health insurance to kind of get a better understanding, but of what your plans like co-insurances are and deductibles. But your medical cost for this example is what they pay, so what your health insurance pays, so that would be 80%. And what you're in charge, that co-insurance is at 20%. So for example, let's say that you have an you need to take an X-ray. They need to get an X-ray, and that X-ray is $100. So in this case scenario, out of that $100, your plan covers 80% or $80 of that, and you pay the $20, which is at 20%. So again, kind of check with your summary of benefits to better understand your plan specifically. But in this case scenario, so the co-insurance, it's just that percentage. So insurance will pay their percentage, and you pay your percentage after your deductible has been met. The copay. The copay, it's a fixed amount that you pay for a health coverage service or medication. Out-of-pocket maximum, the out-of-pocket maximum is the limit or the cap of expenses that the insured would pay for healthcare services covered by their health plan receiving during this year. So that's the most that you would pay throughout the year. So for example, I'm a visual person, so kind of seeing this in a picture kind of helps. So the out-of-pocket maximum is the most you would pay. So let's say your out-of-pocket maximum is at, $5,000 or $1,000. That's the most that you would pay. Your deductible, your copay, and your coinsurance, all that once when you're using it, you're using your services, you go to the doctor and you're paying anything out of pocket, that goes towards your out-of-pocket maximum until you meet that out-of-pocket maximum. Once you have met the out-of-pocket maximum, then everything is covered at 100%. But you have to meet that out-of-pocket maximum. Again, if you're not using your plan, you don't go to the doctor, you're not seeing it, like then you won't have to be paying this, just your monthly premium. But none of like the deductible, the copay, coinsurance, and out-of-pocket maximums on here. In-network versus out-of-network. Your in-network, so refers to doctors, hospitals, and pharmacies, which your health plan contracts to provide medical care at a lower price. And then out-of-network refers to providers that serve and services that are not covered by your health plan, except in emergencies, and cost are so much more higher. So when you are out of network, it's as if you didn't have any health insurance, like you're paying everything out of pocket. Connect for Health Colorado does not pay anything out of network. So you always just have to make sure that the doctor that you are going to, the doctor you're seeing, is in network and is contracted with your plan, with your health insurance company. So just make sure doctors, hospitals, pharmacies are in network. Out of network, and except for like a life or limb emergency, then at that point it would be covered if it's out of network. But that is the only time. Like, so for example, if you're hiking, in a different city, and you break a leg and you need to go to the emergency room, so that would be covered. But any follow-ups, if it's the same doctor or like within the same area, then that wouldn't be covered unless that they are in network at that point. Also, one thing to touch base, make sure that you're checking your doctors, because sometimes the same doctor that you are seeing, you could be seeing your doctor for 5 years, and then all of a sudden they are no longer in network. So just make sure that you're checking that. Best practice, verifying that they are continuing to be in network, at the beginning of the year or when you schedule an appointment. Finding a provider. Check on your company's website or application on your phone to church and search provider directory or find a doctor. Call the insurance company directly. That's always best practice. Confirm with your doctor when scheduling your appointment. Again, once I know I touched briefly a little bit ago, Connect for Health Colorado plans do not cover out-of-network benefits, so it is very important to stay in network. Um, and then if for any out-of-state coverage, definitely call your health insurance directly. I'm typically they won't cover outside of the state, but always give them a call just to verify that information. These are the phone numbers for the plans that are offered through Connect for Health Colorado. So Anthem Blue Cross Blue Shield, Cigna, Kaiser, Rocky Mountain Health Plans, and then that also United Healthcare and Select Health. Some of the reasons that you would contact your health insurance company. So if you haven't received your medical cards once you sign up, great time to give them a call directly. Or perhaps if you see your doctor, you receive like the bill or the explanation of benefits, and it's something that was supposed to be covered is not covered on there. Also contact them directly and just say, hey, I saw this that it was supposed to be covered, or can you explain to me why it wasn't covered on here? So, but yeah, these are the contact informations directly for those health insurance companies. So the insurance apps for your phones. So this is what they would look like. So Cigna, United Healthcare, which is Rocky Mountain, Sydney Health, which is Anthem, Select Health, and Kaiser Permanente. And urgent care versus emergency care. Urgent care, you know, any minor injuries like sprains, strains, small cuts, cold, flu, sore throats, earaches, and infections. Um, Emergency room, something more serious like a heart attack, stroke, severe burns, major injuries, uncontrolled bleeding, or loss of consciousness. Um, that's kind of when you would be going. Also, emergency rooms operate 24/7, 365 days a year. Urgent cares have specific like hours, and sometimes they're closed for holidays. So, you know, and then also this is just a disclaimer that the information is not medical advice. These are just examples of when somebody should be going to urgent care and when somebody should be visiting the emergency room. Um, but yeah, some typically we've had quite a few questions of when you use one or the other. But yeah, urgent care is something more minor, something that's not as severe compared to the emergency room. An explanation of benefits. So explanation of benefits, also the EOB. So it looks like an invoice, but it's not. So anytime once you visit your doctor or you utilize your health benefits, you will be receiving an explanation of benefits. Um, so this is kind of explaining the services that were used at that time. So this is kind of what it's going to look like. So it's going to have all of your information. So your name, your member ID, and then your doctor's name. It's also going to have the date of services, the description, so of the services that you were there at that time, any codes that they use to bill the insurance company, the amount that was billed, the amount allowed, and the amount that was not covered, if there was any copay or coinsurance, and any deductible that was paid or met at that time. This is important because this is where you're going to see if there's services that were covered, or what wasn't covered specifically. And then it's going to say plan pays. So anything that your plan is being paid, and then if you are responsible for any of it, it's also going to show on here. At that point, if you are responsible for a certain amount, you will be receiving a bill, an invoice at sooner or like later on. Um, but again, if something looks different and something is not covered that you thought was supposed to, or something that looks off when it comes to that doctor's visit on the explanation of benefits, make sure you contact your insurance company directly and kind of have them explain to it as well. Also, one important thing, so if you download the insurance applications, like the apps on your phone, most of them, like you'll be able to see the explanation of benefits before you receive it, or and it will kind of explain to you, like, if you go to it and then you write like the description on there. Let's say it's just a physical or like an annual exam, and you can click on it, like it will explain to you what that entails, or like why you owe this much. So it also, those apps on your phone are very important if you create an account, and kind of just go through it, because those apps have a lot of information, and a lot of the times it will describe more in depth of like questions that you may have on the EOB. And then report changes. So it is important to report changes in your household size, income, or address within 30 days of that change. So it's very important. So you'll be going into your actual Connect for Health Colorado account, excuse me. So this is what it looks like up on the first, when you first log in. You're gonna go to make changes on here. You'll go through the whole application pretty much and report those changes, and then you'll just resubmit that application. So just, be mindful you have the 30 days. If you need help, you know, making those changes, you can always contact one of us as sisters, schedule an appointment, or you can always call Connect for Health Colorado directly as well. So to review your plans, so we're going a little bit more in depth here of like how to review your plans. Once you've selected a plan or once, like just to verify your coverage dates or the tax credit that you're receiving. Even you'll be able to see that information on here, like the tax credit that you'll be receiving. But you're on the main page. You'll scroll down to the bottom and the last option. Do you want to review your plans? You'll click here and it'll bring you to this page. So my plans on here. So you'll be able to see any current plans, future plans, or any past plans at that time as well. The coverage dates, very important on here. So for example, this plan started May 1st, 2025, and that is good through December 31st, 2025. You're going to be able to see the financial help that you're receiving, so that tax credit that you qualified for. Um, and then you'll be able to see like your deductibles on here, your out-of-pocket maximums. So you'll be able to see all that information as well on here. If you do need to cancel the plan for whatever reason, this is where you would be coming and canceling that medical plan or a dental plan. A very important thing to know when it comes to like if you have multiple people on a plan and you just want to cancel the plan for one person, you wouldn't come here and cancel the medical plan because that would be canceling for everybody. But you would actually call the customer service center right here, this phone number, and having them remove that one person from your medical plan or your dental plan. Again, if you hit cancel 2025 medical plans or whatever year you're on, then at that point you would be canceling for everybody in your family or everybody on this plan. So again, make sure you call the customer service center line or schedule an appointment with us. Um, but if you are having to cancel just one specific person, you actually would not contact us. You would just contact the customer service center at Connect for Health Colorado. Verifications. So customers are first notified of their verification requests and deadlines on the eligibility notices that they've received after submitting an application. If no documentation has been provided or the documentation provided is insufficient, you will receive 3 reminder notices. And those notices they're set at 45 days, 70 days, and 90 days after the verification was initially requested. And then not providing verification can result in the loss of coverage or financial help. So it is very important to submit those documents. And then just a reminder that customers can still provide documents until the deadline is listed on their notice. So customers will continue to receive additional notices reminding them of the deadlines and importance of providing those documents. If you need assistance in uploading those documents or have any additional questions, again, call the customer service center, or you can give us a call and we can kind of help you upload that information. But there is no way of us seeing if that was successful on on our end. There's just no way. So that would actually just go directly. That would indicate a call directly to Connect for Health Colorado. Perfect. And then uploading your documents. So this is where you would go. So once you've logged into your main account, so this option, do you want to upload or review documents? So you would select that. And this is what it looks like. So uploading your documents, this is what they're gonna look like, and you're gonna be seeing them once they're uploaded. Once you refresh that page, you'll see them on the bottom here. So you can always just name them beforehand before uploading them, just so you know exactly what is what. Again, if you have any questions, or need help uploading those documents, you can always schedule an appointment with one of us. If you submitted documents and no longer see the verification request listed on my documents, then the documents provided sufficiently verified eligibility. Customer, you will also receive any updated eligibility notices that confirms ongoing eligibility and does not contain a verification request. If you've submitted, excuse me, if you've submitted documents and still see the verification request listed, and that's more than like 10 days, um, please just contact the customer service center and just make sure, you ask them like, hey, like what's going on? I'm still seeing this and, it's still requesting verification. Um, they will not send you anything to confirm that information. So make sure that you are kind of on top of it. Again, contact them directly and ask those questions. And perfect. Well, this was the end of our presentation. This is our contact information for the Health Coverage Enrollment Center, our phone number, website, and our email. Um, please, if it's just any questions, just please send us an email or give us a call or schedule an appointment, and we'd be more than happy if we can't help and kind of guide you where you should be or where you could get those questions answered. But thank you so much, and I hope you have a great rest of your day.